Fibroman here. Thanks for joining me today, and hope you enjoy the Fibroman Superhero Squad channel. If you have fibromyalgia, you are considered a superhero, or if you are a supporter of someone who has fibromyalgia, you're also a superhero in my book. And it's just a fun way of, and kind of a creative way of looking at, honestly, a very difficult chronic condition. So today I want to give you some information that I received from a doctor from the University of Michigan. His name is Dr. Daniel Clauw, and he is the director of the Chronic Pain and Research Center for the University of Michigan. And he has made strides in the study and understanding of fibromyalgia. And he has also worked with the Food and Drug Administration to have pharmaceutical medicines that are available for treating fibromyalgia. So, thank you, Dr. Clauw. We appreciate you so much. And Dr. Clauw is certainly a superhero. So, I want to get right into. There are two questions that I asked Dr. Clauw. And the first one was, would there someday be a possibility of using the MRI technology that you used in your study findings as a tool for diagnosing fibromyalgia, along with the widespread pain index and symptom severity scale? And the symptom severity scale is exactly what it sounds like. It's going from like 0 to 3, I believe, that is going to show you options for choosing where you're at as far as the severity of your symptoms. And then the widespread pain index is more of location. So the widespread pain index is interesting because if you have a person with fibromyalgia fill that out, the paper won't hardly have any room left because it has a picture. Well, I can show you. I'll show you that one. Hang on a second. All right. So here we go. So this is what you see, the different locations where you can have the pain, and, you start having an individual with fibromyalgia put notes and stuff everywhere. And then the symptom severity scale, all right, is kind of a second part of that. And here's the 0 to 3, like, rating as far as fatigue, waking unrefreshed, and then cognitive symptoms. So very important tools. But so I'll get back to the answer that he gave me, and it really wasn't an MRI that he did in his study. It was called fMRI, and the fMRI is a little different because the fMRI kind of says a little bit more of how the brain is functioning, if that makes sense. So that's one of the studies that he did, where an individual would have this fMRI, and then pain would be introduced and be measured at their thumbnail. So it was a tool. It wasn't someone's finger, but this tool that would measure the amount of pressure. And then they could use the fMRI to see the activity in the brain, and the individuals that had super sensitivity to that pressure, that could be identified. So a very useful study that was done, and great findings if you want to look that up. So his answer on that was, someday we may be able to use the fMRI, but at present all analysis are of groups, not of an individual's fMRI results. And a lot of us write articles about how to diagnose and treat fibromyalgia, but we don't have enough space in writing something as comprehensive as I suggest. I kind of got ahead of myself a little bit because he answered both of my questions. The Second question was, do you know if anyone has developed a best practice for assessing and treating individuals with fibromyalgia? For example, a practitioner's diagnosis checklist from top to bottom listing the most common primary and associated conditions along with treatment options. So, and I really appreciate him getting back with me. I try the best I can to understand things and to ask things the way I should. And but basically, it seems like it kind of comes down to it's just such an individual type of condition, because it varies so much between one individual to another. You just have to find a good doctor who is able to identify those things and believes in fibromyalgia and has an idea what may be the best course of treatment for you. So I just wanted to cover those two questions. I'm sorry I made it a little long, but I was able to slip in there a little bit about what the widespread pain index was and the symptom severity scale. I want to also go ahead and show you a picture of Dr. Clauw. That's him right there. So he's, again, with the University of Michigan Pain Research Center. And we are very thankful for individuals like Dr. Clauw who are raising awareness of fibromyalgia and who are out there fighting for us, because we really need it. Love you guys. Remember, we're in this together. Have a wonderful day.